All right, so this is going to be our endocrine review. So true or false, protein hormones have receptors inside the cells. So this is false. So again, looking at the difference, so again, when we're looking at hormones, we have receptors that are going to be inside the cell and outside the cell. So remember, if it's a protein hormone, then it's going to have receptors on the outside of the cell, and then it's going to have the secondary messenger system that's going to have the effect inside the cell. If it was um, a steroid or a lipid soluble hormone, then it's going to be able to go into the cell. And the receptors are either going to be in the cytoplasm or it can even go into the nucleus, and the receptors can be inside the nucleus. So, fat soluble or steroid hormones are going to be in the inside and have intracellular receptors. Protein receptors can't diffuse into the cell, so they're going to have extracellular receptors on the outside. True or false, antidiuretic hormone is released from the anterior pituitary. This is also false. Remember, antidiuretic hormone is released from the posterior pituitary. Remember, it's stored and released by the posterior pituitary. Same with oxytocin. All the other kind of controlling hormones are going to be anterior pituitary, antidiuretic, and oxytocin are posterior pituitary. True or false? Upregulation is the increase of cell receptors. So this is true. And we're gonna look at this. So if you're looking again and recognizing kind of cells, so when we're talking about upregulation and downregulation, it has to do with the amount of receptors. And this could be intracellular, extracellular receptors. So if we have a low amount of hormone, and we have a cell that really wants that hormone, it is going to make more receptors or upregulate the amount of receptors on the surface of the cell. That means whatever little hormone that we have, the chance of it getting to a receptor and having its effect and having enough room for all of it is higher when you have more receptors. Down regulation is in response to a lot of hormone. So you have tons of hormone, and you have the cell that's sick of having the response. It doesn't want to have the response as much as the hormones being released. So it's going to downregulate, meaning it's going to have less receptors. So once the receptors are full of the hormone, then nothing else. So you can't have an increased effect of constantly having hormone attached. So remember, it talked about it with, especially you see it with diabetes mellitus. So if it's type 2, if you have tons of insulin because your pancreas is releasing insulin to consistently high blood glucose levels, well, your cells are going to be like, okay, I have enough blood glucose, I have enough sugar, and I'm sick of insulin. So it's going to actually downregulate and have a decreased response to insulin because of constant insulin being released. So it's going to downregulate. So upregulation, more receptors. Downregulation, less receptors. So it's in the direction of receptors, not in the amount of hormone. It's actually the opposite of the amount of hormone. Go back to the other screen. Glucocorticoids cause which of the following? Decrease in blood glucose, increase in blood glucose, increase in fat storage, increase in immune function. So think of it in the name glucose, glucocorticoids are going to increase blood glucose. So things similar to um, glucagon. So you're going to increase your blood glucose. You're going to break down fat. You're going to make glucose. You're going to break down amino acids if you need to make glucose. You're going to break down glycogen, that glucose storage molecule, to increase your glucose. Because glucocorticoids are saying that you need glucose because you need to increase your metabolism. So that's going to be all the things of glucocorticoids is increasing your blood glucose. It also, in excess, can cause a decrease in your immune system function. So steroids are actually at a high dose of glucocorticoids, at a high dose are actually immunosuppressant. So true or false, an autocrine has its hormonal effects on the same cell that produce the hormone. It's true. So think auto means self. So it's a self hormone. It's the one that's produced by the cell and then it has its effect. Remember, a paracrine is going to produce a hormone and have an effect on its neighbors. So the difference between an autocrine and a paracrine. True or false, oxytocin increases breast milk production. This is false. So yes, oxytocin released by the posterior pituitary and females having its effect for labor, so causing uterine contractions. But remember, oxytocin is causing milk ejection. So prolactin is what's making milk, making breast milk. Milk ejection, so actually coming down to the nipple and getting out, is going to be oxytocin. So you actually need both hormones to feed an infant. But so you make it with prolactin, think of pro milk or lactose. Milk ejection is oxytocin. Prolactin produced by the anterior pituitary, oxytocin, the posterior pituitary. True or false, growth hormone is released by the posterior pituitary. So this is false. Remember, growth hormone is actually released by the anterior pituitary, and it's not a stimulating hormone, it's direct hormone. It's going to be more in children, and it's going to have a direct effect on the skeletal system and the muscular skeletal muscle system. So think of what growth hormone does of is increasing glucose so you can have growth in bones and in the skeletal muscle. Anything that you can increase growth and increase size, you're going to do so that way. So make sure you remember and understand what's happening, what growth hormone does to your body. True or false, glucagon decreases blood glucose. That is false. So again, think about what glucagon does. So a lot of things are going to increase blood glucose, but think about what glucagon does. So everything that you can increase your blood glucose. So glucagon is you haven't eaten in a while, but you're not passing out from low blood sugar or low blood glucose. So glucagon's going to have everything where blood glucose is going to increase. So if it needs to make new blood glucose, if it needs to break down glycogen, the storage molecule, then it's going to increase. Remember, insulin is decreasing blood glucose. We think of it kind of differently because insulin's released after you eat. But what happens after you eat? Your blood glucose goes up. Insulin makes it so glucose not leaving your body, but it's going into your cells. So it can go inside to make ATP. Glucagon is going to get to the point where blood glucose needs to be high. You're thinking, okay, well, isn't glucose need to be inside the cells? Well, what uses glucose as an energy component exclusively? Your brain. So you need a way to maintain a certain level of blood glucose to maintain consciousness and your brain functioning. Insulin, after you eat, you increase your blood glucose, then it can go inside the cells and be used for ATP, and you can store it as well. Glucagon, you're going to break down storage and get it out and make sure that your neurons in your brain, especially, is going to have enough blood glucose to keep functioning until you eat again. True or false, aldosterone increases water reabsorption because of sodium reabsorption. That's true. So again, back to my PowerPoint. So remember, aldosterone is released because the kidneys are going to show that there's low blood pressure. Now, this oftentimes could be low blood volume, dehydration, some sort of reason that the kidneys are saying that there's not enough blood pressure to them. They're not happy. So they're going to release renin, and then it's going to go to angiotensin and angiotensin 2, and then it's end up going to be aldosterone. And we'll see aldosterone again, but what happens is then it tells the kidneys to reuptake or reabsorb sodium. And again, we'll talk about with the kidneys, but what happens with the kidneys is through blood, it pushes everything else and then it grabs it back what it selectively what it needs. So it's going to take back more sodium. It's not going to urinate it out. Wherever sodium goes, water's going to follow because it's a strong solute. Water's going to want to go where the solutes are. So sodium's going to go, water's following. So then if you're keeping water, then you're increasing your blood volume. More blood going through your vessels. So this volume isn't going to put much pressure on your vessels. This volume is going to put more pressure on your vessels. So just by increasing your blood volume, by increasing the amount of water that you're keeping inside, not going to urinate it out, then you're going to increase your blood pressure. And that is going to increase the pressure to your kidneys, and it's going to stop asking for aldosterone. True or false, thyroid hormone increases metabolism. This is true. So again, think about what happens with thyroid hormone. So it's going to increase your heat production. It's going to help with um, chemical reactions going on in your cell. It's going to maintain heart rate. It's going to help your skin stay healthy. So think about, again, all the things that thyroid hormone does and is involved in. And it's involved in a lot. So your thyroid hormone is your major metabolic hormone, at least one of them, that's going to maintain kind of a lot of the reactions that are happening inside your body. True or false, melatonin is produced by the hypothalamus. So this is false. Remember, melatonin is produced by the pineal gland. The pineal gland is in the brain, like the hypothalamus, but the melatonin is produced by the pineal gland and has its effect on the brain because major component is going to be your sleep-wake cycle. So again, more melatonin produced at night makes you sleepier. So it's having more effect on your brain for sleep. Less melatonin in during the day available because you want to be awake. Again, hormonal stimuli causes hormone release because of changing electrolyte levels in the blood. True or false? So this is false. Hormonal stimuli is going to cause hormone release because of other hormones. Humoral stimuli is going to be because of changing levels in the electrolytes. So you can look at being released because of sodium levels is going to be a humoral stimuli. Hormonal is going to be thyroid stimulating hormone is going to release thyroid hormone. So remember the difference between hormonal and humoral and then neural, which is the nervous system. So if thyroid hormone level is high, then thyroid stimulating hormone or TSH levels are increasing. So that's false. We're going to go to this guy. Negative feedback, our friend. Remember, pretty much everything but oxytocin in labor in females is going to be, at least of what we talked about, negative feedback. So it's going to go to the point where everything's normal. So if you're getting an increase in thyroid hormone levels in your blood, then you don't need as much because it's high, and you don't need thyroid hormones to be high at all times. So high thyroid level is going to have a negative feedback where you want to go back to normal. So we have a reference range, again, kind of looking at blood work. So you want to have a thyroid level in the normal level. So it's not true, but think of it as at 5 to 10. If your thyroid level is all of a sudden at 15, again, these aren't real numbers, just kind of giving examples. Well, that's not normal. We want to get back to our 5 to 10 range. So we have enough thyroid. We don't want the stimulus to release any more thyroid. We want to stop it. So we have a negative feedback on the anterior pituitary producing TSH, and we say stop it. If you stop producing TSH, then the stimulus to release thyroid hormone goes away. So you stop releasing thyroid hormone. We can also have it on the TRH, the hypothalamus. So you can say, stop that too. We have enough. So you stop the stimulus, you use the thyroid hormone as you need it, then you're going to get back to your range. Now, all of a sudden, if you have low thyroid level, remember negative feedback can go either way. So you have low thyroid, say it's at 2. Well, your body's going to say, I want more. So low thyroid is going to say, okay, release TSH from the anterior pituitary and stimulate that thyroid to release thyroid hormones. So then it goes down to the thyroid and you release more hormones to get back between your 5 and 10. So again, remember and make sure you understand negative feedback and kind of how it applies here. So I hope this helps kind of review. If you have any questions, just let me know. If not, I'll see you during lab.